Hello, everyone. I'd like to thank the Academy for the invitation and the opportunity to be part of this very important conversation. So as we've been discussing earlier today, there is a need and a critical role to infuse health literacy practices into every step of the clinical trials process from start to finish. But I'm going to take a few steps back and talk about the critical conversations that occur or need to occur well before a patient decides to participate in a clinical trial. I'm a rheumatologist and an allergist immunologist, and I'm a principal investigator on numerous clinical trials that are investigator-initiated, that are part of national collaborative networks, that are sponsored by industry partners. So I have a lot of conversations about clinical trials. We're going to think about when, where, and how these conversations are occurring. I'll give you a broad overview of the design and implementation of several programs that I'm leading or co-leading on a national and institutional level to help facilitate these conversations. And then I'm going to leave you with some thoughts on our baby steps towards creating a health literate clinical trials environment. This is a patient of mine who's in a clinical trial, and she wants her photo to be shown and her story to be told, because she and so many others like her are sent to my clinic from across the southeastern United States because they've failed multiple therapies. And I continue to argue that the therapies have failed them. And so I have conversations about clinical trials with my patients, not just because I care about advancing science, but because there is a critical need for newer and better therapies for my patients. And it's a good thing that I have these conversations, because it turns out that the majority of patients who participate in a clinical trial learn about it from their provider. But let's think about the backdrop in which these conversations are occurring. We know that health literacy demands are placed on patients as soon as they set foot in a hospital or a clinic. So there's signs, there's directions, there's instructions, there's paperwork, front desk staff, all of this stuff is going on that's confusing for everyone, let alone someone with limited health literacy. There's a busy clinic, there are limited time slots. And so what's happening in these encounters? So on the bottom, you'll see from the patient's perspective, there's an overload of information. It's difficult to understand and process. Oftentimes, patients are learning about a new diagnosis, there's prognosis, there's medications, there's doses, there's costs, and then there are all these other factors, family, culture, belief, and even harder for patients with limited English proficiency. And then the question that I get from my colleagues and physicians across the country actually is, so in the middle of all of this, when, where, and how are we supposed to have these conversations about clinical trials? Is this a good time? If not, when is a good time? So it's not surprising to me, and I think it's probably not surprising to this audience, that there are a lot of times when these conversations never occur. This is from a patient. I had no idea about clinical trials. It was foreign to me. It's like a foreign word. I had never heard of it before. And sure enough, at least from this survey, 85% of patients were either unaware that participation in a clinical trial was an option at the time of diagnosis, and the majority of these patients said that they would have been willing to enroll if they had known it was possible. So on one hand, you have patients who would have been willing to participate in a trial had they been given the information. And then the flip side of the coin, we know that approximately 90% of clinical trials fail to meet their recruitment goals. So what I think we have here is really a failure to communicate. So while it's great that efforts are focused on patients who are in the trial around informed consent, engagement, and retention strategies, I think that health literacy efforts should be prioritized well before the actual trial begins, even well before recruitment. So we know that there are a lot of barriers to patient participation in clinical trials. There are patient-side barriers, physician-side barriers. On the patient side, there is access, opportunity, trust. There is health literacy, there are culture, there are beliefs. On the provider side, there is also awareness and knowledge about clinical trials. There are implicit biases. There is also just logistics around when are we going to have this conversation. So our work really emphasizes a couple of these areas. One is lack of physician awareness and knowledge about clinical trials, and then we are working on addressing clinical trial health disparities. And we know that minorities specifically are disproportionately affected by limited health literacy and a limited English proficiency. There are about 100,000 clinical trials operating in the US, and African Americans make up only 5% of participants, and Latinos only 1% of participants. So through our work, we're asking some critical questions. Can we improve healthcare provider literacy about clinical trials? Can we improve physician communication skills related to discussing trials using patient-centered communication? And can we equip clinical trial sites to recruit minority and limited health literacy patients? So I'm going to talk about 3 programs that as I mentioned, I'm leading or co-leading with multiple project partners that I'll introduce in just a minute. But what's common to all of these programs is that while they're disease specific to lupus, they are clinical trial agnostic interventions. So they're not focused on one particular clinical trial, but really around the general idea about enrolling patients or educating patients about clinical trials. They've all been developed with input from extensive patient input panels, and they all are culturally and linguistically tailored. So the first program is the Materials to Increase Minority Involvement in Clinical Trials, which is a program that has been built by the American College of Rheumatology, funded by the Office of Minority Health, and I'm thrilled to be co-leading this effort. This is a multifaceted intervention model that builds on 3 categories: educational materials, and then educational outreach using those materials, and patient-focused interventions. And we're looking to evaluate providers' knowledge, attitudes, self-efficacy, and behavioral intention to refer minority patients to clinical trials and assess the feasibility of a clinical trials recruitment model. So these materials are developed already through this program. They are available free to download online. And they include, on one hand, educational modules for providers. They're interactive videos, transcripts, and slides. They're educational materials tailored for patients. And then there are tools which are distribution guides for clinical trial sites to help them conduct outreach with providers. So at the center of this model really is the patient and patient-centered communication. And the idea is that principal investigators and clinical trial staff, such as my clinical research team, for example, would reach out to providers, because how do other providers, whether they're in the community or at other academic medical centers or primary care providers or subspecialists, know what clinical trials might be available to their patients? They're not going to know. They likely don't have that knowledge and awareness of all of the trials that are happening around for their patients. So the idea is that using these kits and using this materials, the staff and the principal investigators team will conduct this outreach. The providers will then be empowered to share information with their patients, and this in turn will affect patients in that they will be willing to consider their options to enroll in a clinical trial. The second part of this project is working on developing evidence-based and expert-informed practical guidance on how clinical trial sites can most effectively conduct outreach. And as you can see, to Larry's point earlier, that PCPs are at the top of this list of providers that are at the center of the outreach. And that is the focus of this grant that was just funded recently. Next, we're working on outreach towards healthcare teams, because we know that nurse practitioners, physician assistants, nurses, all of those teams are involved in the discussion about clinical trials. We're including subspecialists, so everybody who cares for the lupus patient, not just the rheumatologist, but the nephrologist and the dermatologist, so they are aware about clinical trials and are knowledgeable in case the patient wants to talk to them about participating in a clinical trial. And we're expanding the outreach to patients, to Hispanics in addition to African Americans, in all of the materials that we are developing. I'm also leading a longitudinal study in Durham, North Carolina, and there's one in Rochester, New York, so that we can test the real-world effectiveness of these models to see how they perform in those real-world settings. I'm going on now to the next program, which is the PALS, Patient Advocates for Lupus Studies program, which is funded and supported by Lupus Therapeutics and the Lupus Research Alliance through the Lupus Clinical Investigators Network, which is a network of clinical trial sites across the US and Canada. Other project partners are KDH Research and Communication, which is a research firm, and my co-PI is at Emory University. And this is an early educational intervention to introduce clinical trials to individuals before they have to decide if they want to participate. And we know that the peer-to-peer communication models have been particularly effective in communities, in engaging communities with the healthcare system, as well as in other diseases such as oncology primarily. But this is an area where lupus particularly, or this disease, in which it hasn't been applied across the board to clinical trials. In a survey in which 300 lupus patients were surveyed and asked what would motivate you to participate in a clinical trial, 80% of respondents said that talking with other patients who have taken part in a clinical trial would have made them very likely to participate. So based on this, the PALS program was designed as a peer support and an educational intervention. So 27 individuals, including principal investigators, the patient advocates, facilitators, all of us came together for a live training session in Miami. And the key thing about this program is that all of the training materials and program are developed with input from patients living with lupus themselves. And as you can imagine, the patient advocates are of different literacy and health literacy backgrounds across the board. We have 45% of those individuals have some sort of advocacy experience. 18% have a high school diploma, 45% have a master's degree. So there's a range there. And the training session and all of these materials are developed to cater to all of that wide range. And as I mentioned, this is not just a support group. This is an educational intervention that is being tested. There is HIPAA-compliant, specialized web-based software that has been developed for the patient advocates to conduct outreach with patients. And these are the structured sessions that the PALs are going to be using. These are the topics that the PALs are going to be using to conduct outreach with the patients. And as part of this study, we are looking to measure clinical trial knowledge, obviously satisfaction with the program, intentions, and attitudes towards clinical trials. Because we know that in terms of behavior, when we want to try to assess behavior, the best predictor of someone's behavior is really their intention to perform that particular behavior. And the last program that I'm going to talk about now is a program that I'm leading at UNC, which is called Project Purple, with project partners including Lauren's group, which is RTI International. Other project partners for this are Pattern Health, which is a mobile app company. And this is really a mobile platform that we are developing. It's culturally tailored to all literacy levels and personalized. It incorporates animations that explain complex study concepts such as randomization and informed consent that Lauren showed you. And all of the knowledge assessments and surveys are based on specialized principles such as teach-back. And you know, it's an interesting, I think, thought-provoking time in our evolutionary history because we no longer have to make a case for why it's important or why we are using mobile technology for any specific intervention. Because for the first time in history, more people have access to a cell phone than they do to a toilet, running water, and consistent electricity. And actually, cell phones and smartphones are helping to bridge the gap. If you look here, and look at the whites on top, then we have blacks and then Hispanics right here. You'll see that smartphone, blacks, Hispanics, and whites own mobile devices at similar rates, which is not the case when you look at desktops or home broadband. And 22% of Hispanics and 15% of blacks are smartphone-only internet users. What that means is that they don't have home internet, but they use their cell phones particularly for all of different purposes, but particularly they are more likely to rely on their smartphones to look up their health information. So the idea for this project came not only from all the conversations that I have with my patients about clinical trials again and again, But from all the conversations and all the times I didn't have that conversation, as you can probably imagine from the patient slide I showed you in the beginning, and doctors are a trusted source of health information. We know that patients consistently rate their own doctors as the most trusted source of health information, but most physicians don't have time, which is sufficient, or resources to discuss clinical trials. So this tool, this mobile digital tool that we are developing, is the first of its kind to educate patients about clinical trials through interactive content, which is using custom-built physician avatars that are modeled after the patient's real-life treating physician. So there's an avatar for me, and I will provide the voice of my own avatar, and my colleague, Dr. Alfredo Rivadeneira, is a Spanish speaker, and he's providing the voice for his own avatar. And Lauren showed you some photos of the specific avatars, but these avatars are different because they are designed after the patient's own physician. And we will have, hopefully, results of this pilot study in a year to share. So I'm going to spend a couple of minutes now talking to you about our experience at UNC within the clinical trials program at the Thurston Arthritis Center, and our efforts towards creating a health literate clinical trials environment, and what we're doing to sort of adapt universal precautions. The first one, which I think is really, really important, at least in my clinic, is the idea to educate all patients about clinical trials, whether or not they are going to be able to enroll in a trial or not. And I think the most important part of this is to check my implicit biases at the door. So I'm not the one who's going to decide that I'm going to talk to Ms. X about a trial and not to Ms. Y, because I feel like Ms. X may be more likely to either understand that information or to participate. Because if I educate everybody about clinical trials, then I'm checking my own biases at the door. And I think that's a really important thing that we all need to stop and think about for a minute. We always advocate for consideration of participation and never to encourage participation. As we've heard before, it's important to clarify to patients that a doctor-patient relationship will remain unaffected regardless of their decision to participate in a clinical trial or not. And then all of the resources and tools that I've shown you are there to help individuals make informed decisions. We are educating providers about clinical trials, so not just, like as I mentioned, not just rheumatologists who care for these patients, but really primary care providers, subspecialists, and healthcare teams. And the outreach is targeted, again, yes, towards patients, but also towards providers that are involved in the care of these patients. And communication is really key. And my team, I have to say, does a stellar job with communicating with all the physicians and the providers that are involved in the care of the patients. Because one thing that people mention is that once patients go into a clinical trial, their doctors really have little knowledge and understanding about what's happening, and that makes for poor communication all across the board. So all of the patients who enroll in our clinical trials sign a release of information for whichever providers they wish for us to disclose their information to, and my team does a great job of making sure they receive that information and also follow up with regular phone calls. I think we also need to think about whether you can infuse health literacy into clinical trials in isolation without creating a health literate healthcare environment, right? I think you can't do it in isolation. And so there are organizational things that need to happen. For us personally as a group, I will tell you that our informed consent already is a multi-step process. And I was mentioning that to Chris. I noticed before, and this is a few years ago, that patients, once they were going through the informed consent process, I would walk into the room and they had no questions and they were ready to sign. And to me, that indicated that they probably didn't understand or they hadn't read the consent. And now our multi-step process ensures that all patients receive a copy of the informed consent beforehand. So they receive it by email and by snail mail with a follow-up. So we have a process as part of our standard operating procedures where that is followed up by a call by our clinical trials coordinator. And then by the time they come to the visit and they've spoken to my coordinator, and by the time I walk into the room, they have a ton of questions for me usually. And that to me suggests that they understand, or have at least have some understanding of what they're getting into. We have customizable templates for patients which are study specific. And I want to say that the teach back principles work not just for patients, but also for personnel training for research personnel. Having bilingual staff has been key for us to be able to enroll patients who speak a different language, for example, Spanish, and having not just consent forms, but also supplementary information in other languages is key. So I'm going to leave you with this slide, which is, I think, how a lot of us feel, which is that this is a dynamic state, which is influenced by how well we, and this is a collective we, all of us who are involved in clinical trials and all of the project partners deliver information that matches patients' abilities, needs, and preferences. Thank you for your attention.